I'm here to tell you about why accountable care is going to change your life. Now, what is accountable care? BJC now has an Accountable Care Organization, which is a group of about 500 doctors and nurse practitioners that are caring for tens of thousands of our Medicare beneficiaries who have regular Medicare as their insurance. And we're responsible for something different than we used to be. We're responsible not just for taking good care of them when they're in our hospital or in our medical offices, but actually we're responsible for the quality of care that they receive and all of the costs of health care that they receive, no matter where they receive it. So we're actually accountable for the whole medical picture of all of our Medicare beneficiaries. So what does that mean to all of us as healthcare providers? Well, let me walk you through an example, and I'll try to tell you how taking care of these people now, and really taking care of all of our patients now, is fundamentally different than what you and I are used to as BJC employees. I'd like to introduce you to two patients of ours who are in our Accountable Care Organization. Margaret Hamilton and Donna Rodriguez, and they're both about 70 years old, and they had very similar things happen to them. And so let's walk through what happened to each of them and the different ways that we had a chance to care for them. So Donna and Margaret both have congestive heart failure. They're active, vibrant people who are out and enjoying their lives, but they have a problem with congestive heart failure. And so their medical journey with us started with admissions to our hospitals for congestive heart failure. They both spent about 2 days in our facilities and got tuned up and were put on some different heart medicines and some medicine to manage the fluid in their body to help them kind of balance this out. After 2 days, they were in good shape and they were able to get out of the hospital. So Donna, on the right side of the screen, you'll see, was able to see her cardiologist within 2 to 3 days after she got out of our hospital. And the cardiologist noticed something very important, that the medications that they had given Donna to help her heart failure had actually dropped her potassium too low. And Donna was both dehydrated, and she was also starting to have heart rhythm problems and go into a heart rhythm we call atrial fibrillation. This was a problem, but the cardiologist was able to correct that quickly and change her medications and get her back on good footing. Now, Margaret had the same problem, only her physician on the way out of the hospital had said that they'd like to see her in about 2 weeks. She also had the same problem at home, but there was nobody there necessarily to catch that. So about 5 or 6 days after she got out of our hospital, Margaret started to feel sick, weak, her heart was racing, and eventually she called 911 and was taken to our emergency room and brought into the hospital with the new onset of that heart arrhythmia. She was cared for very well. She spent a couple of days in our hospital. Interestingly, though, part of the treatment was to give her a lot of fluid to make up for being so dehydrated from the medicines she'd gotten before. So unfortunately, after she was done with that admission to our hospital, she had another admission to our hospital, now for congestive heart failure again, because her body was holding too much fluid, and we had to get rid of that. So both patients then had several visits with their primary care providers and with their cardiologist to get everything tuned up, recheck the potassium, and both were in good shape. But then something else happened to both of them that is a very common thing in our senior population. They had a fall at home. And so Donna was in pretty good shape. She had been up and active. Her stay in the hospital was only 2 days. And so when she fell in and injured her knee on the floor, she was able to get to an urgent care facility and have it treated there and be able to go back home. Margaret wasn't so lucky. Margaret, if you count up on the screen, has now spent a total of 8 to 10 days in our hospital. It's a lot of time in bed. And she was having difficulty actually even walking to begin with, feeling more weak and tired from everything that she'd been through. So she actually had a 911 visit back to our emergency room and was seen in the emergency room. They accurately diagnosed the problem and were able to send her home. But she had to use an ambulance and had to use our emergency department to do that. If you look on the right side of the screen, Donna then had something very important. She had a primary care physician arrange for some services to help her at home after this fall. And so an occupational therapist was able to go out and see her in her home, take up throw rugs, put in some grab bars in the bathroom where many folks can have slippery floors and fall in their bathrooms, and do a few things that were helping her get back on her feet and avoid the next fall. Margaret wasn't so lucky. Margaret was treated very well in our emergency room and went back home, but nobody was there necessarily to help her with those other things. And so what happened next is what happens very often in our senior population. There was a second fall. Only this time we're going to pay for it because she fell on a hard surface. She was weak and could not get up, and when the ambulance crew came to get her and bring her to the emergency room to be evaluated, it was clear that she'd broken her hip. So with that, then she was brought into our hospital just like any patient normally would. She was given a new hip, had a hip replacement surgery, along with all the regular post-op care and the right things to do for her to help her get better. That included then a skilled nursing facility stay to help her get strong and be able to transition back home. And Margaret ended up getting back home. But let's take a look at these two patients of ours and the kind of care that we gave them. And let's, for just the sake of argument, assume that in both cases, we can confidently look at the medical care that each of them got and say with confidence that each part of the medical care was done very well. So in the emergency room, everybody triaged them appropriately, helped them with their pain, the x-rays and tests were done correctly, and on the floors, the nursing staff were attentive, the medicines were correct and hung at the right time, the doctors did a great job on the hip replacement, all the post-op care was good. If all of that was good, we'd be pretty happy. We'd be pretty proud of ourselves. We did a good job for both of these patients. But let's step back a second and think, who did we really serve? Who do we serve well in this? Donna was able to deal with the medical problems that she had, recover quickly, stay independent and in her home, and in the end, only had about $9,000 in medical bills, of which she was responsible for about $1,600. Margaret wasn't so lucky. Margaret had more problems, more disability from this. She ended up with surgeries that theoretically wouldn't be needed. And she ended up with $54,000 in medical bills, of which almost $10,000 was her responsibility. And if you know seniors living on a fixed budget, that's a big deal. So how do we care more for our patients like we did with Donna and do a great job for them and have fewer complications and difficulties like we did with Margaret? Well, the difference is accountable care. And the good news is with accountable care, every one of us as BJC employees can contribute to this. You don't need to be superhuman. You don't need to go to great lengths to help somebody in this way. And you certainly don't need to have gone to a prestigious medical school in the Ivy League. All you have to do is two things. You have to do a good job for the patient in what your role is when you see them, either in our clinics or our hospitals. And then you have to ask a second question. And that second question is, are we as a system, are we as a care team doing everything we can for this patient so that they will do well once they leave our office, they leave our hospital, and they go back to their real life at home? And if the answer to that is no, and there's needs that the patient has that we're not meeting, collaborate with your team members and we'll take care of it. And if we do that, then you make a real substantial difference in people's lives. And this is not a slogan. This is your ability and my ability and our opportunity to make a real substantive difference in their lives and actually make medicine better for these patients. That's simple, it's easy to do, and we all can participate. And that's how accountable care will change your life.